Hello and good morning. My name is Melinda Salinas and I'm with DC Health. And today I'm accompanied by our director, Dr. Ayanna Bennett, to talk to you about diabetes. Welcome and thank you for joining us to have this conversation today.
Thank you, Melinda, for having me. Thank you, everyone.
So, can you tell us what diabetes is and how does it affect the body?
So diabetes essentially means sugar in the blood. And people who have diabetes have it for a couple different reasons. Either they have sugar in their food, they eat it like all people, but their body doesn't produce the insulin it needs to move that sugar from the blood into their tissues.
Okay.
Your body wants sugar, your muscles use it, your brain uses it. It's not a bad thing, it's a good thing, but you have to be able to use it. So that is one kind of diabetes. The other is that you make insulin, you eat the sugar, but your body doesn't respond to it very well. And so those folks need other kinds of medicine to make their body respond to the insulin they make. Sometimes they need insulin themselves, but that's a second kind of diabetes.
So as someone recently diagnosed with type 2 diabetes, what would be the difference with someone like me with type 2 versus someone with type 1 diabetes?
So someone with type 1 would most likely have been diagnosed as a child.
Okay.
It is something that typically starts in childhood, usually earliest childhood. And that person makes no insulin at all, usually. And that means that they are somebody who takes insulin shots. They monitor their sugar very closely because they can't do anything with it except for the insulin that they take. And so that is somebody who is going to be taking a medication really no matter what they do for the rest of their life.
Oh.
Somebody with type 2 diabetes usually has lived well into adulthood without having to think about blood sugar at all, and then suddenly they do. So that is somebody who now has a chronic disease they didn't have, and they have to learn about moderating their diet. They take some kind of medication, but generally they can change their lifestyle in a way that potentially they could not have diabetes anymore, or at least have very controlled diabetes, and then be able to live with little or no medication. So it can be a very different life.
Yeah.
Somebody who quite intensely knows about sugar and insulin and does this as part of their daily life, and somebody who is maybe changing their lifestyle to try to deal with something, but it usually is of different intensity.
Thank you for explaining the differences between that and what your potential lifestyle can look like. So we know that recent data shows that more children are being diagnosed with diabetes. As a pediatrician, can you talk to us a little bit more about that and what's happening and how we can help prevent that?
Generally what we're talking about is children, usually older kids, who are now developing type 2 diabetes. So in the last, I'd say even couple decades, we've started to see kids who, instead of in their 40s developing type 2 diabetes and insulin resistance after decades of living a lifestyle, they're developing it at 16 or 17.
Wow.
And so that means that the things that we know happen after decades of chronic disease, diabetes can be very hard on the kidneys, it can be hard on the heart, it can be hard on the blood vessels everywhere. Anywhere you have blood vessels, you can have problems from diabetes. Those kinds of things, instead of happening 30 years after you get diagnosed at 40, they're happening 30 years after you get diagnosed at 16. So that means that you might be in your 40s, your kids might be young, you might be still working, you have lots of demands, and now suddenly you're having all of these more intense problems from your disease. So that is where it's a problem. We want folks to be able to manage their disease and have fewer long-term side effects, but that gets harder the younger you start.
So keeping that in mind, what are some of the challenges or barriers that you're seeing in terms of what's causing this or preventing management of diabetes, and what can community partners or healthcare providers do to assist with that?
So there are two things. First, we want to prevent people from getting type 2 diabetes as much as possible.
Okay.
So the things we think help lead to type 2 diabetes are a diet that isn't as nutritious as it should be. So more sugar, less vegetables, than you should have. And so the healthier you eat for more of your life, the less likely you are to ever get diabetes, but if you do, you'll get it at a much later age. So we're looking for people to eat that kind of healthy fruit and vegetable, whole food kind of diet, and if they can do that, it tends to prevent diabetes or at least make it happen later and less intensely. We also want folks to be able to manage their diabetes well if they get it. And so that includes a lot of things. If you're changing the way you eat, you're changing your exercise, you're doing lots of more medical appointments, those things all take resources. So it is expensive and inconvenient maybe to have to get different kinds of food than you're used to eating. People develop what they like to eat over a long period of time, and now suddenly some of the things that you eat are maybe not the best and you should eat different things. That is a big deal for somebody to try to change. There's lots of medical appointments that need to happen if you're going to manage a chronic disease well. You need to really get a relationship with a medical provider who understands you, and that's because the disease changes over time. Either your medication is going to work, which means you have to have visit after visit to really try to find the right medication for you, or you're going to make lifestyle changes and you're going to need less medication. All of that means somebody's got to watch it over time. They've got to see how you're doing now, see you again in 3 months. And if you have problems with transportation or childcare or getting time off work or all those things that make it hard to get to the doctor, if those are already a problem, having a chronic disease means that they're more of a problem. And those are the people who don't get their diabetes managed well.
Thank you. So it sounds like definitely eating a healthy diet,
Getting your exercise.
Getting your exercise, knowing and understanding your diabetes, and making sure that you're following up and keeping up with your appointments, but also understanding what are some of your barriers to being able to get the healthcare or maintain your appointments. So what can our healthcare providers or community partners do to help someone with that?
I think there's a role for both the community providers and for the patients.
Okay.
So we talk about something called health literacy, where it is what a patient learns so that they can understand what the health community is telling them. So learning about what diabetes is, learning about what all the medications are for. There's a lot to learn if you're going to have a chronic disease and manage it well. You have to really understand what everybody's talking about. That's one kind of health literacy. The other kind of health literacy, though, is how do we as a healthcare community talk to people in a way that they can understand? So how do we say it in a way that's easier to understand so that you don't have to learn 57 things in order to know what your medication does, so that you can understand why you're coming back to the doctor, why you need to change your medicine? Because these are dynamic diseases. They change as your weight changes, as your diet changes, as you get older, as you go through menopause. All these things that happen to the body change how your disease is operating, and you're going to need to understand the decisions that go along with that, the changes that are going to be made in your medications, or not needing medication, or needing another medication. All of that is very dynamic, and so you have to be an interested and involved person who is dealing with a system that is really working hard to make sure you understand. If you don't have both of those, then it can be very hard to manage. And that means that if you have a problem with transportation or getting the food that somebody's asking you to get, you have to say so, because there are resources, but they have to know that you need them. So right now we're doing a couple of different programs with folks that if we know that you have a problem, you might be able to participate in. So some patients are being enrolled in an Instacart program.
It's wonderful.
Where we're working with Instacart to give people the ability to have their groceries delivered. And that means hopefully that they're able to get over some of those barriers of transportation or other issues that keep them from getting to the store to get those fresh fruits and vegetables. Maybe you can't get to the store often enough to have fresh because it'll go bad in your fridge. Well, now you can have Instacart deliver it. That's a help, but only if somebody knows you need that help. So you have to be able to tell the doctor, oh, I can't do that. If you're the kind of person who can't get their medication follow-up visits, maybe they can do those by telehealth. maybe you can get them delivered from the pharmacy, but only if they know you need that. And the same thing on the provider side, they have to be able to ask, I'm asking you to do something, are you able to do it? And not just presume. So everybody has to have much more thoughtfulness about how to get the information back and forth than they maybe had in the past.
All right, thank you. So you mentioned that DC Health has an Instacart a program with Instacart to help reduce the transportation barriers in terms of getting access to nutritious food. Are there any other things that DC Health is working on to
So first, that's a pilot, so we're going to see how that works. So we're studying it with just 500 individuals to start with to see how it works. If it does, then maybe we'll shift money from other things to try to expand that.
Okay.
But that is how that program is designed, and we'll see. Other things that we're trying to work on are helping our providers do a better job of following people, of doing navigation for folks and trying to get them back into the office more effectively. There are lots of things that are in need of improvement in the way we deliver healthcare, and we're working with various different kinds of providers to see what kind of improvements we can make.
So DC Health has some food service programs. Can you tell us a little bit more about that?
Well, the one I would highlight for folks with diabetes is Food and Friends.
Okay.
We give funding to an organization that delivers medically tailored meals to people. So they do a wide variety. So folks who have hypertension or other diagnoses that need low salt, they do low salt. For diabetes, they do meals that are more tailored around the need to control your blood sugar. That kind of service comes through a connection with your physician. So that's something they could refer you to if that's something that you need. I would talk to your doctor about that. But that kind of program, trying to figure out how to get people who need specific foods, those specific things that they need, is what we're really working on hard here.
Thank you. So to end our conversation today, is there any final thoughts or words that you would like to tell our listeners to either encourage them with better managing their diabetic diagnosis, or for family members who are supporting with someone living with diabetes?
Well, as I always say, if you are with somebody who needs help, the first thing to acknowledge is that they are already trying. So it is hard to manage a chronic disease. It is hard to change your diet. It is hard to take medicine every day, and to especially people who have to check their blood sugar and all the things that go along with managing diabetes well. And so there may be things that they need encouragement on, but that's not because they're not already dealing with a lot of stuff. So if you understand what all has to go into it, then you can find ways to be supportive. If somebody has to change their diet and they're in the same household as you, it is very helpful if you change with them. There is no one who is not improved by having a healthier diet. So even if you don't have diabetes, those changes are for you too. And so supporting them instead of opposing them would be really helpful to this person. Really helping to support them in all of the organization that goes into a chronic disease diagnosis. You have to get to the doctor, you have to track your medicines, you have appointments with the pharmacist, with the doctor. It can get complicated, particularly if you've got a family member who is older or needs extra support in that area. You have to recognize that they're going to need some help with that organization. And then for the folks who have diabetes, acknowledging that it's difficult and picking one or two things to really focus on. Maybe all you can manage right now is managing your medication and getting your blood sugar under control. And then once you have that down and it's more straightforward for you, maybe then you're going to work more directly on your diet, or you're going to work on your diet right now and you're going to look at your exercise afterwards. Everything can't happen at the same time. Most people have a certain amount of change that they can manage, and that's true even when you have an important diagnosis like diabetes. So talk to your doctor about what the priorities are, what needs to happen right now, what you can do and get support on right now, and then make a plan that actually gets you where you need to go at some point. And if we give ourselves time and support, we can usually do everything that's needed.
Well, thank you for taking the time to talk to us about diabetes. I'm certainly informed a little bit more about diabetes, living with diabetes, but also how my community or the support systems around can help me better manage my diabetes as well. So we hope that this information is also helpful to you or someone in your life with diabetes. Thank you again.
Thanks, Melinda, for having me.